So good morning everyone. आज का सेशन मैं ले रहा हूँ. So before we can start the session, I'll take some question answers. How many know what is CPR? अपने आप को अनम्यूट करके बताइए what is CPR? What do you know about CPR?
सर जैसे सर ने बताया था कि जब ऐसा कुछ हो तो अपनी छाती पीटने की वजह से जिसको हो रहा है उसकी छाती पीटो.
हाँ, क्या हो रहा है? किसको क्या हो रहा है?
पेन या कुछ हार्ट में पेन है, घबराहट हो रही है.
मतलब आप किसी के हार्ट में पेन होगा तो आप उसको मारने लग जाओगे?
नहीं, मारने नहीं.
मतलब उसको पहले पेन हो रहा है तो आप उसको और मारने लग जाओगे? और बताइए कोई और CPR के बारे में किसको पता है?
जब किसी के साथ डेथ हो जाती है तो हम इमीडिएट ये अगर ट्राई करते हैं तो सर कहते थे बहुत लोगों को रिवाइव किया जा सकता है अगर उनका दिल की धड़कन रुक गई है या हम देखें कि वो कि ना हो चुकी है उनको, तो उस समय एक बार ट्राई करना चाहिए जरूर.
तो यस, वेरी इंपॉर्टेंट पॉइंट इज जिसके ऊपर आप CPR परफॉर्म करोगे उसकी डेथ हो जानी चाहिए. जिंदा आदमी पे आप नहीं करोगे परफॉर्म. अगर कोई इंसान बोल रहा है कि मेरे चेस्ट पे पेन है और आप हाथ रख के बैठे हो और उस पर CPR करने लग जाओ, दैट इज रॉन्ग. CPR इज अ फर्स्ट एड फॉर अ पर्सन हु इज क्लिनिकली डेड. क्लिनिकली डेड का मतलब होता है उसका हार्ट फंक्शन बंद हो गया है बट ही स्टिल, his brain is still working. Now CPR is performed in the first 10 minutes and technically the first 2 minutes. And how do you know that, let's say आप किसी बंदे के पास across, like you know, if you come across to a person, आप कमरे में आए हैं और आप देखते हो कि बंदा गिरा हुआ पड़ा है, मरा हुआ पड़ा है, तो आप बोलते हो कि मुझे नहीं पता कि वो पहले 2 मिनट हैं, पहले 10 मिनट हैं, 2 घंटे हैं या 10 घंटे हैं. You will start performing a CPR as soon as you see the person unconscious, in a state where he does not respond. You do not know whether he is dead or not. So there are some steps you will perform. And once you find out that this person is not responding to the initial steps, then you will conduct the CPR. But आपको ये नहीं देखने की जरूरत कि वो 2 मिनट हैं, 5 मिनट हैं, 10 मिनट हैं, 2 घंटे हैं, 10 घंटे हैं, doesn't matter. You will start performing the CPR if you find the person is clinically dead. Anybody else want to talk about it before I can start my slides? And let's make it interactive. मेरे को ना सुबह नींद बहुत आती है, तो अगर आप लोग भी सो रहे होगे तो फिर मैं सो जाऊंगा बीच में.
सौरभ सर, उसमें टाइम का नहीं होता? जैसे अगर बहुत ज्यादा टाइम हो गया और डेथ का तो
आपको कैसे पता ना? वही मैं बोल रहा हूँ. Within 2 minutes आपको देना चाहिए CPR. अगर 2 मिनट के अंदर नहीं दिया तो there could be a damage in the brain. So first 2 minutes there is no, first 2 or 4 minutes there is no damage for the brain. After 10 minutes there is definite damage to the brain. But we have also seen the effective CPR where the revivals have happened after 30 minutes also. But because when you go back to the person, you do not know what time was it. So you need to perform CPR ASAP. CPR से कोई harm नहीं हो रहा, वो बंदा already मर चुका है, right? So अगर वो बंदा मर चुका है तो आपको क्या फर्क पड़ता है? आपके एक एफर्ट से वो जिंदा हो सकता है. You do not know when it has happened. So since everybody is sleeping, I'll open the slides.
Prayer kare sir.
Okay. So we will talk about hands only CPR, and before that I will invite to have morning prayer. कौन करेगा?
आशु जी.
गुड मॉर्निंग एवरीवन. दिवंगत आत्मा डॉक्टर के सर को प्रणाम. आज 12 सितंबर आज की प्रेयर हृदय से मेरे भगवन एक ओम नाम निकले, हृदय से मेरे भगवन एक ओम नाम निकले, चलते व फिरते सोते तेरा ही नाम निकले, चलते व फिरते सोते तेरा ही नाम निकले, हृदय से मेरे भगवन एक ओम नाम निकले, नाड़ियों से नसों से आँखों की पुतलियों से, नाड़ियों से नसों से आँखों की पुतलियों से, हर रोम रोम से भी, हर रोम रोम से भी तेरा ही नाम निकले, हृदय से मेरे भगवन एक ओम नाम निकले, अंतिम समय भी भगवन जब प्राण हो लबों पर, अंतिम समय भी भगवन जब प्राण हो लबों पर, अंतिम समय भी मुख से तेरा ही नाम निकले, अंतिम समय भी मुख से तेरा ही नाम निकले, हृदय से मेरे भगवन एक ओम नाम निकले। धन्यवाद।
थैंक यू आशीष जी। एंड मेरे पास देखो सिर्फ आधा घंटा है, सो आई वुड लाइक एवरीबडी टू पे अटेंशन एंड CPR कैन नॉट बी जस्टिफाइड इन हाफ एन आवर, इसको कम से कम मिनिमम 2 घंटे से लेके पूरा दिन लगता है। मैं आपको बेसिक सिखा रहा हूँ एंड विद दिस ऑल्सो यू कैन स्टार्ट परफॉर्मिंग CPR. So CPR is not a course, it is a technique more of. So if people can open their camera also, I will feel that people are learning because this is an important session. आप एक NGO के साथ जुड़े हुए हो, तो if going forward back anywhere, if you find today only somebody needs a help, it will be a successful program. So hands only CPR, CPR 10 is what we have started. So it was one of the very, very important initiative by Dr. KK, and we have saved a lot of life with it. When we say we have done for police, we have done for hospitals, we have done for government institutes. आप जहाँ पे बोलोगे हमने वहाँ पे CPR करा हुआ है, schools में, colleges में, सारी जगह करा हुआ है. And we have got a lot of successful stories. So just to talk about, we are Limca Book of World Record holder, and we have been got 3 times Limca Book of World Record for training maximum number of CPR in a day. We are also in collaboration with Red Cross Society. So this is Dr. KK's funda, and everything जैसे बच्चों को याद कराते थे, कोई एक राइम पोएम वगैरह बनाते थे जिससे कि याद रहता था. This is a very, very important way you should all learn. इसको कहते हैं मरने के 10 मिनट के अंदर, जितना जल्दी उतना बेहतर. So read every line, read every word has a meaning in it. मरने के 10 मिनट, so it talks about the importance of how to start the CPR early. मरने के 10 मिनट के अंदर जितना जल्दी उतना बेहतर. सो इट डज नॉट डिफाइन कि आपको 10 मिनट के अंदर अंदर ही करना है. आपने जब देखा उसको तब सीपीआर शुरू करो. कम से कम अगले 10 मिनट तक, मिनिमम 10 मिनट्स, मैक्सिमम कुड बी 40 मिनट्स, 50 मिनट, डजंट मैटर. जनरली मैक्सिमम इज टिल द टाइम यू गेट अ मेडिकल हेल्प. कम से कम अगले 10 मिनट तक जितना देर उतना बेहतर. 10 into 10, 100 पर मिनट की स्पीड पे अपनी छाती पीटने की जगह पे मरे हुए इंसान की छाती पीटो. अगेन देयर आर टू थिंग्स इंपॉर्टेंट ओवर हियर. इंसान मरा हुआ होना चाहिए 100 पर मिनट की स्पीड पे मिनिमम, और कम से कम 10 मिनट तक. सो अगेन, टू रिवाइव अ पर्सन फ्रॉम अ सडन कार्डियक डेथ within 10 minutes, at least for the next 10 minutes, longer the better, compress the chest, center of the chest of the dead man 1.5 continuously with a speed of 100 per minute. So first aid, CPR is also known as a first aid for a dead person. आप एक फर्स्ट एड देखते हो जो नॉर्मल पर्सन का है, एक डेड पर्सन का फर्स्ट एड इज अ सीपीआर. फर्स्ट एड क्या होता है? जो सबसे पहले फर्स्ट एड दे दे. फर्स्ट एड इज अ मेजर ऑफ immediately after an incident or an accident which has occurred. So whoever is close by, he gives you a first aid. It is available for human and material, so I'll skip all these things. Objective is to preserve life, to prevent the victim condition from worsening, to promote recovery. So what is CPR? It is also called basic life support. It is an emergency life-saving procedure. CPR is cardiopulmonary resuscitation. It is heart and lung revival. It is an emergency life-saving procedure performed when the heart stops breathing. Immediately, CPR can double or triple the chance of survival after the cardiac arrest. It is useful for many emergencies such as heart attack, electric shock, banda pani mein doob gaya hai, and someone who is not breathing and heartbeat has stopped. So this is a very important point for you. If you are afraid of doing CPR or unsure how to perform CPR correctly, know that always it's better to try than nothing. Nobody can stop you if you want to do a CPR on a dead man. You are doing on a good faith. There is no legal implications. आप किसी के बंदे को देखते हो, वो मरा हुआ पड़ा है, आप उस पे CPR परफॉर्म कर सकते हो. There is no legal implication because your intention is to save life and the person is clinically dead. The difference between doing something and not doing can save a life. So there is a difference between a heart attack and a cardiac arrest. A heart attack occurs when the blood supply to a part of a heart stops and thus causes a section of a heart muscle to begin to die, whereas a cardiac arrest occurs when the heart stops beating as a whole. Basic life support refers to the care healthcare provider and public safety professionals provided to the victim who are experiencing a respiratory arrest, cardiac arrest, which we have already covered. It includes a quality CPR, using of AED, and relieving from a person from an airway obstacles. Victim of all ages. CPR can be performed to a pregnant woman, a child, an infant, an adult, a woman, anybody. Sudden cardiac arrest is 10% of total mortality. So why do you want to perform a CPR? CPR saves life. Currently, about 9 in 10 who has a cardiac arrest outside the hospital dies. So you can see how important is a person to know the CPR. आज की तारीख में अगर किसी को कुछ होता है कमरे में, वो अकेला है या मैक्सिमम उसके फैमिली मेंबर्स हैं. The hospital is away at least 20 minutes. अगर आप जितना मर्जी कोशिश कर लो, 20 मिनट से पहले आपके पास एम्बुलेंस नहीं आ सकती. अगर आप भी गाड़ी में लेके जाओगे तो भी आपको कम से कम मिनिमम टू मिनिमम 10 मिनट्स लगेंगे. If you can perform the CPR at home, it can save and improve the chance of survival. It is also seen that the person, if he is taken to the hospital, the chances of survival are low because the CPR is not performed at home. It is performed in the first few minutes of cardiac arrest. It can double and triple the chance of survival. Cardiac arrest often happens at home. जब आप सो रहे हो, जब आप उठ रहे हो, जब आप खाना खा रहे हो, that is when the cardiac arrest happens. Out of 10, 7 people get cardiac arrest at home. आप हॉस्पिटल में जाके आपको कार्डियक अरेस्ट नहीं आता, आपको कुछ सपना नहीं आ रहा कि आप जाओगे हॉस्पिटल में और वहां पे जाके आपको कार्डियक अरेस्ट होगा. आपको घर में पेन हुआ है, इसीलिए आप हॉस्पिटल जाते हो. So the event has already occurred. If your bystander that time can perform a CPR, nothing like it. Most of them do not get help because people do not know what it is. You do not need a formal training to perform a CPR. I repeat, you do not need any education. You do not need any training. You just need to know the technique. Kawalji ji, please mute your. If the arrest happens somebody near you, don't be afraid. अगर आपको टेक्निक भी नहीं आती है तो भी आप उसकी छाती पीटिए. Does not matter. डॉक्टर के कहते थे अगर उसकी हड्डियां टूट रही हैं सीपीआर करते हुए, does not matter, आप तोड़ दो हड्डियां. इफेक्टिव सीपीआर इज गुड, बट अगर आपकी वजह से उसकी हड्डियां टूट गई हैं, रिब्स टूट गई हैं, does not matter. रिब्स टूट गई हैं, उनको डॉक्टर हॉस्पिटल जोड़ देंगे. इट इज अ माइनर थिंग. अगर बंदे का हार्ट रिवाइव नहीं करा है और माइंड ब्रेन्स जो है वो कोलैप्स कर गई हैं, देन देयर इज नो वे यू कैन सेव. So introduction, according to the recent statistic data, sudden cardiac arrest is a rapidly becoming increased cause of death. Once heart ceases from function, human brain may survive without oxygen for only 4 minutes without suffering a permanent damage. This is important. 4 मिनट तक ब्रेन को कोई डैमेज नहीं होता. 4 to 6 minutes, there is a possibility that the brain will get damaged. 6 to 10 minutes, there is a high probability that the brain will get damaged. After 10 minutes, it is a very, very severe that the brain will certainly get damaged. But अगर आप 3 मिनट से 5 मिनट के बीच में उसको रिवाइव करते हैं तो there is some kind of a damage which is already done to a brain which may not be reversible. But it is fine. Do the CPR whenever it is. Some people even have a favorable outcome after 38 minutes. So do not stop the CPR unless you get a help. But each minute passing, the heart stop beating, the odds of survival are very less. It gets dropped by 5%. Survival to the hospital discharge presently is only 5 to 10, which is 14%. If you do a CPR early, within 1-2 minutes, the survival goes beyond 60%. Prone CPR, we will come back, but standard CPR is always performed when the person is laying on the back. If you cannot move the person by any chance, अगर आप उसको उल्टा नहीं कर पा रहे हो, so you can still perform a prone CPR. But as per the American Heart Care Association, it is recommended to always perform the CPR, which is a spine CPR, if the victim cannot be turned. What you need is, if you see the image, this is how the person is required to perform the CPR. Look at his feet, look at his legs, look at his arms. It is all interlocked. It is important when you are performing a CPR, somebody should call up the emergency help, which is 112. This is a CPR you need to perform, an AED machine. That is all you need. And if you see, his arms are locked here. It cannot bend here. This needs to straight. So basically, इसको कहते हैं ये इंसान खड़ा हुआ है बैठने वाली पोजीशन पे, नीज की पोजीशन पे. So adult chain of survival. First, you need to identify the person is dead or not. Right? The first step is to check, to make sure that your environment is safe. You check the person is dead, उससे आप पूछ रहे हो, बात करने की कोशिश कर रहे हो, वो respond नहीं कर रहा, उसकी heartbeat check कर रहे हो. That is an immediate recognition and activation. The second is early CPR. Do not waste time. The first step should be completed within 10 to 12 seconds. This is between 10 to 12 seconds. Do not spend time on it. Do not take 2 minutes to spend on it. This needs to start within 1 minute. You do not need more time. Early CPR. And then call for help. And this is an AED machine. AED machine aap dena hoga. And then this is where you stop. This is doctor's thing. You do not need to go here. This is your forte. This you can perform without any problem. So what you need is immediate recognition and activation, whether the person needs a CPR, perform a CPR, and perform an AED. The help comes, get out of it. You do not need any more. So for an adult, this should be the hand, the way you should do it. For a child, you can have this. For an infant, you just need 2 fingers. How much you need to press? At least 2 inches. Does not matter whether it is a child or adult or infant. You have to press at least 2 inches. Perform 30 chest compression at the rate of 100 per minute, letting the chest rise in between. So नीचे जाना है, वापस ऊपर आना है, नीचे जाना है, वापस ऊपर आना है. Minimum 2 inches. The rotation should happen. ये नहीं कि आप सिर्फ दबाते रहो. पूरा recoil होना चाहिए, ऊपर तक आना चाहिए. So what is immediate recognition and activation? You have to first identify the scene safety. आप airlines में जाते हो, आप बोलते हो, वो पहले बोलता है कि पहले आप देखो, अपने आप को safe करो. अगर आप किसी का accident हो रखा है और आप सड़क के बीच में हो, वो बंदा, आप वहां पे CPR दे रहे हो, तो आपको भी खतरा है, उसको भी खतरा है, और क्योंकि कोई एक्सीडेंट दोबारा हो सकता है. So first you have to make sure that the scene is safe. Victim का, self का, and if required, only if it is required, उसको move करके कहीं और लेके जाओ with the help of others. But that should all done it in first 20 seconds. Do not waste time. Let's say किसी को electric shock है, वहां पे wires पड़ी हैं, आप उसको वहां पे जाके scene safety नहीं है. You have to make sure that the scene is safe. Check responsiveness. This is the art when you can check. नहीं तो आप उसको उसकी छाती पे आप देख सकते हो कि उस पे मार के बोल सकते हो कि are you there, are you not there. आप बोल सकते हो कुछ हो रहा है आपको, कुछ नहीं हो रहा. If he responds, get out of it. If it does not respond, check his breathing, check his pulse, give him pain, give him pressure. आंखों के ऊपर का जो पार्ट होता है उसको दबाओ. That is the most painful area. If you give the pain, अगर वो बंदा जिंदा है, वो उठ के बैठ जाएगा. अगर आप लोगों को नहीं करना ये सब चीजें और आपको लगता है कि वो बंदा मर गया है, perform a CPR. Does not matter if you do not able to check the responsiveness. Why? Because जब आप पहला CPR perform करोगे, वो इतना पेन देगा छाती में कि अगर वो बंदा जिंदा है तो वो उठ के बैठ जाएगा. So technically the first step of the first pressure on the CPR will give you the responsiveness. You do not need to wait again. अगर वो बंदा जिंदा है, वो उठ के एकदम से मर जाएगा, वो उठ जाएगा. Before you perform a CPR, call for help. चिल्लाओ लोगों के ऊपर. Somebody help, somebody help. Call the police, call the cop, call 112, call whatever number we have here. Clear the message. Once you're on the call, again, you do not need to spend the time. You can start the CPR, you can put on a loudspeaker, you can ask somebody else to do it, but जो भी इमरजेंसी हेल्प होगी उसको आप क्लियरली अपनी लोकेशन बताएंगे, उसको बोलोगे एईडी मशीन लेकर आएंगे। अगर आपको एईडी मशीन के बारे में नहीं समझ में आ रहा तो आप बोलो जिससे झटका लगता है मशीन छाती पे, जो करंट देती है मशीन। बट मेक श्योर बिफोर यू कट द फोन बिकॉज यू आर इन अ पैनिक। जनरली आप सीपीआर उस बंदे को परफॉर्म कर रहे हो जो आपका लव्ड वंस हैं, सो यू आर इन अ स्टेट ऑफ शॉक। मेक श्योर यू टेक द फीडबैक। सर आपने कहाँ आना है, किस एड्रेस पे आना है, और अगर कोई भी आपके बगल में हेल्प नहीं है तो आप खुद फोन मिला लो, एक हाथ से फोन मिला लो, एक हाथ से सीपीआर दो, and then you check the breathing and everything, which is also a part of responsiveness, and then you start the CPR. So I would say I will play this video which Dr. KK has given a lot of answers on this. This is an excellent video. I've chosen it specifically. This will give you a lot of answers, and then I will share more slides. Can you hear my screen? Video की आवाज आ रही है?
We can see, but we can't hear.
Okay, let me share it again then. एक सेकंड, अभी दोबारा बताओ जरा, आ रही है नहीं आ रही है?
नहीं आ रही, नहीं आ रही, वीडियो भी नहीं चल रही।
Hold on.
On a shopping mall, when you see a person collapse suddenly on the ground. You try to wake him up, but he does not respond and is not breathing. You panic and look around for help. Do you know that if you start CPR-10, that is continuous chest compression only cardiopulmonary resuscitation without mouth-to-mouth breathing, you can help revive them?
Okay, so I will point out one point here. There is a lot of debate whether you want to give a mouth-to-mouth respiration or not while performing a CPR. It does not matter. Yes, there is a very minor chance of improvement of the performance of the CPR if you give a mouth-to-mouth. But let's say अगर आप जिस बंदे को mouth-to-mouth देना चाहते हो, आपके पास mask नहीं है mouth-to-mouth देने का, and you're not comfortable, especially in this pandemic, do not worry. Do the CPR. Mouth-to-mouth is not that important then to perform a CPR. Okay?
CPR-10 is a new technique that is easy to learn and easy to do, and more effective than traditional CPR. And you don't need to be a doctor to perform this life-saving technique.
You do not need to be a doctor to save this technique.
You also do not need to be certified to do CPR-10. Before we learn this technique, it is important to know what sudden cardiac arrest is.
Sudden cardiac arrest occurs when the electrical conducting system of the heart fails and the heart starts beating irregularly and very fast, more than 1,000 times, technically called as ventricular fibrillation. The heart suddenly stops beating. The blood flow to the brain stops. As a result, the person becomes unconscious and stops normal breathing.
A cardiac arrest is not the same as a heart attack, but it may be caused by a heart attack.
A heart attack occurs when an artery that supplies blood to the heart muscles is suddenly blocked. The heart muscle dies because of lack of oxygen. In most cases, sudden cardiac arrest may be reversible in the first 10 minutes. The brain remains alive during this period, even though the heart and respiration have stopped. This is called clinical death. CPR-10 or continuous compression only CPR compresses the heart between the sternum and the backbone and builds up the pressure that keeps the oxygenated blood flowing to the brain and keeps the person alive until a defibrillator becomes available or expert medical help is at hand. Defibrillator means an electric shock machine.
So if you see someone collapse from sudden cardiac arrest, acting promptly can save their life.
The best way to resuscitate is to provide mouth-to-mouth breathing combined with chest compressions. But if a sole lay rescuer is present or multiple lay rescuers are reluctant to perform mouth-to-mouth breathing, Heart Care Foundation of India recommends doing CPR-10 or continuous chest compression CPR. Before starting CPR, if electric shock machine is available, give electric shock. If that's not available, you can also attempt before starting compressions, 2 thumbs from a distance of 1 foot in the center of the chest. 1, 2, and start compression CPR.
Let us now learn the correct technique of performing CPR-10 step by step.
Place the person with cardiac arrest flat on his back on a hard surface. Say, just like this, it's a floor. Put him on the floor. Check for responsiveness. For that, shake him. Ask him, are you okay? And if there is no response, put painful pressure on his body with your knuckles on the sternum or on the orbital area. And if there is no response, now look for breathing, respiration. Take your cheek near the nose and look for the breathing. The chest is not moving. And if you find there is no feeling of air on your cheek, the person is in cardiac arrest. No response, no breathing. Cardiac arrest, start CPR-10. To start CPR, it's simple. You need only 2 hands, nothing else. Begin chest compressions. For this, kneel down by the side of the person in front of the chest. I am sitting. Put the heel of your hand in the center of the chest of the sternum. Center of the chest means in between the 2 nipples. Put your heel over the center of the chest in between the 2 nipples. And now put the other hand on the first hand. Keep your elbows straight and bring your shoulder directly over the center of the chest and start compressions. And compress the chest up to 5 centimeters. That's 1.5 inch. Relax, but do not remove your hands. Allow the chest to return to normal position before you push down again. Continue to push hard and fast with a speed of 100 per minute, compressing 5 centimeters or 1.5 inch. Continue it for the next 10 minutes, or if the electric shock machine is available, interrupt, give electric shocks, and then do CPR-10. Or if you find the patient starts speaking, moving, or breathing normally.
The CPR-10 mantra is, within 10 minutes of clinical death, for the next 10 minutes, compress the center of the chest continuously and effectively with a speed of 100, that is 10 into 10 compressions per minute.
Remember to push hard. That means compress 5 centimeters with each downstroke, and push fast means 100 per minute at the center of the chest. Don't worry, this pumping action will not hurt the victim. Even if there is a fracture of the rib, forget about it. We will repair it. It is better to have a fractured, alive patient than a non-fractured ribs, dead person.
Chest compression should be done continuously and without interruptions.
While doing CPR-10, do not stop to check the pulse, clear the airway, or do mouth-to-mouth breathing.
It is important to act quickly. Every minute lost reduces the chances of revival by 10%. So if you wait for 5 minutes, the chances of surviving are 50% less.
The earlier you give CPR-10 to a person in cardiac arrest, the greater the chances of a successful resuscitation.
Chest compression should be done even if the person is gasping.
Gasping is a sign of cardiac arrest. It is most frequent soon after a cardiac arrest and then decreases rapidly with time. Persons with cardiac arrest are more than 5 times more likely to revive if CPR-10 is attempted while the patient is still gasping.
Studies show that CPR-10 is more effective and can save more lives than traditional CPR.
This is because continuous compression only CPR or CPR-10 can be done by trained as well as untrained bystanders. Also, it is easier to learn and perform than attempting to do mouth-to-mouth breathing, which is often done incorrectly. Also, many rescuers are uncomfortable for giving mouth-to-mouth breathing for reasons of health and safety concerns. The simpler hands-only CPR-10 technique helps overcome this hesitation to act. In infants and children or cardiac arrest due to drowning, it is better to do traditional CPR with chest compressions and rescue mouth-to-mouth breathing and not CPR-10.
Sudden cardiac arrest can occur anytime and any place without warning. Doing CPR-10 offers the best chances for survival. Don't be afraid to act. Remember, your timely action can save someone's life.
अभी तक किसी को कुछ आया है या फिर
थैंक यू सर, क्लियर है, बिल्कुल क्लियर है.
So I have American Association video also, but I thought sir का video is more important right now यहाँ पे, इससे हमने सीखा है सारा. I will talk about couple of slides on the AED machine. AED machine is basically a electric shock machine, as you mentioned. AED machine देने से पहले you have to make sure that the person is unresponsive, the breathing is not there, and the pulse is not there. Again, if the AED machine is not there, Dr. KK did mention कि कैसे आप एक shock दे सकते हो. Okay, so I will tell you one of the very funny way I explained to one of the very senior people, and I was very surprised. And Dr. KK was saying कि तुमने क्या बोला है? And then he realized that it was good. आपके घर में कभी रिमोट बंद हुआ है? क्या करते हो आप उसको? टीवी का रिमोट है, एसी का रिमोट है, क्या करते हो? सब सो रहे हैं क्या?
सर उसको थपथपाते हैं, ऐसे मारते हैं, मारते हैं.
वो क्या करते हो उसका?
झटका देते हैं.
कभी सेल निकालते हैं, डालते हैं, फिर दोबारा करते हैं.
शॉक. आपने रिमोट को कई बार शॉक दिया तो वो चालू हो गया. सिमिलरली आपने जो उसको थपथपाया तो उसमें कुछ भी पुर्जा था वो चलना बंद हो गया, वो हिल गया और चल गया. तो द टेक्निक ऑफ गिविंग अ शॉक इज कि जो आपका हार्ट एकदम से बंद हो गया चलना, जैसे आपने उसको शॉक दिया वो एकदम से चालू हो गया. सो इलेक्ट्रिक शॉक गिव्स मोर वेटेज टू हाउ टू गिव अ शॉक. जब तक लेकिन एडी मशीन नहीं आ रही, आप अपने हार्ट को इसको शॉक दो और उस पर सीपीआर परफॉर्म करने दो. सीपीआर से वो हार्ट मूव करेगा, जो भी प्रेशर है वो बिल्टअप होगा और जो भी ऑब्स्टिकल है वो हट जाएगा. In what cases the CPR chances of survival is almost 100%? A question to you. कौन सी डेथ में क्या हुआ है बॉडी में कि आपका CPR most likely 100% effective है? And what is the CPR where it is the lowest?
इलेक्ट्रिक शॉक से डेथ में 100%.
Absolutely. अगर किसी की इलेक्ट्रिक शॉक से डेथ हुई है, उस केस में the chances of survival of CPR is almost 100%. अगर किसी को इलेक्ट्रिक शॉक लगा है, वो नीचे गिर गया है और आपने सामने देखा है और वो रिस्पॉन्स नहीं कर रहा है, you can save him. किस सिनेरियो में बचना मुश्किल है? लेट्स से रोड पे एक्सीडेंट हुआ है, उसके बेचारे की गर्दन कट गई है. अब वो कुछ भी कर लो, वो सर्वाइव ही नहीं कर पाएगा जब तक उसको मेडिकल हेल्प नहीं मिलेगी. तो उस केस में भी if you think that the person is good enough to give a CPR, do it. But electric shock mein the chances of survival are almost 100%. Okay. Now I will share a couple of slides on AED, which we would cover later. We can do a proper session also because we don't have time right now. Again, AED machine का मैं आपको ज्यादा नहीं समझाऊंगा. It's just that you have to simply follow the steps. It can be used by a layman person. You do not again need to be a doctor to use an AED machine. सिर्फ उसकी चेस्ट पे से कपड़ा हटाओ, पैड्स लगाओ, ऑन करो मशीन को, and then machine will tell you what to do. मशीन अगर आपको बोलेगी बॉडी से हट जाओ तो आप बॉडी से साइड हो जाना. मशीन आपको बोलेगी 2 मिनट के बाद क्या करना है. एवरीथिंग इट विल बी द मशीन विच विल टेल. सो हाउ इट वर्क्स इज, पहले मशीन पे जब वो पैड्स लगाते हो वो एनालाइज करती है उसके बाद वो evaluate करती है whether the shock is advised or not advised. अगर वो advised होता है तो उसमें वो एक shock आप उसमें press करोगे, give shock, and then जैसे वो shock होगा उसके बाद आप resume करोगे. Make sure whenever you're giving a shock, you have to say all clear. That means there is nobody who is close to the body. And if in case the AD machine says no shock advised, it could be for any reason, you can still perform the CPR. AD for special saying, we'll skip that, hairy chest, wedge chest, these are all we can learn later. How to perform an effective and quality CPR is, you need to make sure that the position of the rescuer hip is above the patient level. जो hip है वो आपकी ऊपर होनी चाहिए. It should be on a hard surface. अगर soft surface हुआ तो कोई फायदा नहीं है, क्योंकि जितना आप प्रेस करोगे उतनी बॉडी नीचे प्रेस हो जाएगी.
आजा ये छोटू को याद आया तुमको सीमा?
So let us say आपका जो एयर मैट्रेस है उस पे आप परफॉर्म करो, तो जैसे ही आप उसको प्रेस करोगे उतने एयर मैट्रेस नीचे चला जाएगा. सो इफेक्टिव सीपीआर नहीं हुआ है. सो पुट अ हार्ड सरफेस. अगर आप बेड से नीचे नहीं ले जा पा रहे हो उसको, सो व्हाट यू कैन डू इज यू कैन पुट अ हार्ड बोर्ड below the patient. Minimum interruption between the compression less than 10 seconds. Your arm and elbow needs to be locked. अगर वो लॉक नहीं हुआ तो प्रेशर नहीं बनेगा. 2 inches chest compression होना चाहिए. And the major important point is you need to allow the chest recall. अगर ये नहीं हो रहा तो इफेक्टिव कंप्रेशन नहीं हो रहा. तो इसका मतलब है चेस्ट को नीचे जाना है, ऊपर आना, नीचे जाना है, ऊपर आना. What if when you want to stop the CPR? It is very simple. बंदा उठ के बैठ गया, उसको दर्द हो रहा, उसने उठा और आपको थप्पड़ मार दिया कि आप मेरे को क्या कर रहे हो. He is fine. He put him in a recovery. This is a recovery state. If the victim breathes normally, otherwise, if the medical help comes, stop CPR. Your job is done. And if you are exhausted, so ask someone else to replace you. So this was the CPR. This is a crux of CPR. This is a very basic CPR what I have taught. आधे घंटे में I could only do this justice. And we can do more sections on the CPR if it is any interest to you. But for now, I think we will take an exit from the CPR. I would like you to go back, see the video, check again what we have taught. You can also teach somebody else. We as heart care and Dr. KK used to say कि आप CPR जो सीख रहे हो आप अपने लिए सीख रहे हो, किसी और के लिए नहीं सीख रहे हो. अभी जो आपने सीखा है वो किसी और के लिए सीखा है. क्योंकि अगर अभी आपके यहाँ पे किसी को कुछ होता है तो आप उसको बचा सकते हो, लेकिन अगर अभी आपको कुछ हो जाए, अगर यहाँ पे अभी किसी को कुछ हो जाए तो आपको कौन बचाएगा? जो आपके बगल में, आपको उसको सिखाना पड़ेगा कि भैया देख, अगर मुझे कुछ होता है तो पहले आप ये देखो स्टेप्स, और कल को अगर मैं अनकॉन्शियस पड़ा हूं जिसमें मैं रिस्पॉन्ड नहीं कर रहा, मेरी ब्रीदिंग नहीं है, आई हैव अ कार्डियक अरेस्ट, तो आपको ये करना है मेरे साथ. आपने सीख लिया, ये आपका सेल्फिश इंटरेस्ट नहीं था, ये आपने किसी और के लिए सीखा है. अपना सेल्फिश इंटरेस्ट करना है तो आपको लोगों को सिखाना पड़ेगा. With this note, I would like to close this session, and we will go with the Bhagavad Gita. We already have Shashi ji over here. Thank you, everyone. We can take question answers.